Hi, everybody. I'm Abby, one of the dietitians with Season Health, and today I'm bringing you this short video on some need to know information about glucose monitoring. So, the first thing I want you to do is think about driving a car. If you have experience driving a car, you have also experience using monitors. There's several different monitors that help us drive our vehicle. For example, the speedometer tells us how fast we're going, whether we need to speed up or slow down. Maps tell us where we need to go and how far some place is. Our gas gauge, if it's low, we know we need to get to the next gas station and refuel. Our check engine light, we know that our car might need attention and we may need to even bring it to a mechanic. So without these monitors, you may run out of oil, you may get a speeding ticket, you may even ruin the engine or get lost. Or imagine if you weren't able to understand these different monitors. What would happen then? Trying to manage diabetes without glucose monitoring is like trying to drive your car without these helpful tools and monitors that you have in your vehicle. Things might go okay for a while, but sooner or later, the lack of information and not taking corrective action to fix the problem would probably cause serious health problems. Think of the glucose monitor as the instrument panel for the person with diabetes. Knowing what your results mean will help guide the next step. So why monitor those glucose levels? Again, some really important things that I mentioned as we're talking about the car analogy is that it's going to guide what needs to be done. It lets you and your healthcare team know if your diabetes plan is working. If you need to have medications adjusted because your levels aren't hitting your target range, that could be a reason. Again, that's so important when it comes to glucose monitoring. Understanding the impact of food, activity, illness, stress, those things, glucose monitoring can really help you understand how those different things impact your levels. And then it helps you identify high or low, which is really important in keeping you healthy long term. And so understanding what you're feeling, those symptoms and signs of higher glucose levels can be really important to identify it and treat it properly. What makes glucose levels go up? So here are some factors that increase glucose levels that are pretty common. This isn't everything that can impact your blood sugars is not listed here, but this gives you an idea of some different reasons that your blood sugar may be increasing. So again, most people are very aware that carbohydrates impact blood sugars. So eating more of those than usual or something that's higher in carb could cause those levels to go up. If your movement decreases or you decrease your physical activity, missed doses of medications, your diabetes medications, poor sleep, pain, stress, illness, dehydration, potential side effects of other medications can also impact our glucose levels and cause those to go up. What makes glucose levels fall? So here's some factors that can decrease your glucose levels or cause a decrease in those levels. So again, opposite of increase, not eating enough carbs can decrease your levels, or if you're eating less than usual. If your physical activity increases, or again, you're doing more movement than usual, this could be a potential cause. Drinking alcohol can lead to low blood sugars. Too much diabetes medications, maybe you're due for a adjustment. So talking to your healthcare team can be really helpful if you're experiencing a lot of lower blood sugars. Side effects of other medications and even illness can decrease glucose levels. So choosing a monitoring device, I think it's really important to know that if you are a person with diabetes, you should have access to a monitoring device that you can use at home. You have some options to pick from, and hopefully connecting with your healthcare team to determine what is the best option for you based on your preferences and needs is the key. So the two kind of main options are a glucometer, which is using a finger stick check. A small amount of blood is applied to a test strip, and then the glucometer reads your blood sugar reading in that moment. Continuous glucose monitors are applied either to a part of the body where the sensor is placed under the skin. You wear it for up to 14 days at a time, and it's giving you continuous glucose readings either to a reader or your cell phone that can be connected to the device. So I think the key takeaways here is research your options, know what's available, and then determine with your healthcare team, what option is going to be best for you. When to check glucose levels. So again, this is very individualized. This is a discussion you should be having with your healthcare team about what's going to be best for you. I've listed some common recommended times to check. So really great times to check typically are fasting. So right when you wake up in the morning, 1 to 2 hours after a meal can be really helpful in determining how different food is impacting your levels. When you're ill, typically we recommend that blood sugars are checked more often. If you're not feeling right, or you're just not feeling off, or having symptoms of a high or low, if you're familiar with that, then you want to check again to make sure that the blood sugar isn't causing the issues or the symptoms of not feeling right. Physical activity, again, checking before, during, and after activity can be really helpful in understanding how that specific movement is impacting those levels. And then lastly, before bed. So again, key here, talk to your healthcare team about when you should be checking. What are those glucose targets? Again, the theme here is individualization. So here I've listed the American Diabetes Association guidelines for target range for people with diabetes, non-pregnant, and then gestational diabetes or diabetes during pregnancy. So we'll focus on the targets for people with diabetes that are non-pregnant. So before meals, ideally 80 to 130 is ideal. 1 to 2 hours after a meal, that blood sugar goal is typically less than 180. Now, these are the targets that the American Diabetes Association put out that have been determined to decrease complications long-term. So keeping your levels in these ranges is going to help support long-term health for you. So again, they can be individualized. It's going to be based on you and your healthcare provider's discussion. So again, having that conversation with your healthcare team so you understand where your levels should be. So when you're monitoring, those numbers mean something to you. So again, key is individualization, working with your healthcare team to understand where your levels should be. I have listed the normal range. So for people without diabetes, those blood sugars are going to typically stay in those ranges listed there. Sensor glucose level goals are a little different. You can see there's a bunch of different sort of guidelines here when it comes to the different ranges that we're looking for, but focusing in on that middle part of that table, the time and range. So ideally we want you hitting that 80 to 180 range at least 70% of the time that you're wearing that sensor. So again, that's going to help support you staying in that target range, but also preventing long-term complications. So getting to that 70% or more or higher should be the goal. But again, it is individualized. So once again, talking with your healthcare team about what's going to be best for you and your health long-term is key. I want to thank you so much for watching this video. Please follow Season Health for more tips to take charge of your diabetes and your health. Thank you again.